of establishing relative benefit values, identifying peer employers, and how the data outcomes can facilitate better understanding among stakeholders. Today's webinar will be led by Elliot Sessels of Siegel. As always, we encourage you to submit written questions and comments. Written questions and comments can be submitted by using the GoToMeetings dashboard. However, in order to get through the presentation, we will hold all questions and comments to the end. We anticipate the prepared portion of today's webinar will last about 45 minutes. Additionally, today's presentation and any other supporting materials are available in the handout section of the dashboard. And with that, I will turn it over to Elliot.
Thank you, Amanda, and welcome everyone to this afternoon's session. I think the presentation today will really cover three areas. I want to first review this concept of cost basis versus relative value basis, then discuss some of the analytics behind it, and to show the outcome or the difference in what happens when you look at total compensation from a cost perspective versus a benefit perspective. I apologize, I think we're having a little trouble with the slides. Sorry for the delay. Apologize for that. What? Okay, sorry for this technical delay. So the question becomes, why evaluate total compensation on a cost versus relative value basis? Well, first of all, the reason to evaluate total compensation is to support an organization's ability to recruit and retain. And if compensation were simply that which is in one's paycheck, this would really be a pretty easy exercise. We would look at what other employers are paying for folks in similar jobs, compare it to our own compensation, and determine whether there is any gap in that between whether we're paying below market or at market or above market. But in fact, the total compensation offered by public employers is much more complex than that. And it obviously considers not only just base pay and perhaps pay supplements and so forth, but the value of benefits that are provided to employees. And obviously different employers place different emphasis on different components of their total compensation package. So we're going to be talking about the notion that total compensation can be measured both on an employer cost basis. In other words, from a budgetary standpoint, how much does an employer spend on direct compensation, on health benefits, on dental benefits, vision benefits, on various retirement benefits, or on this notion of a relative value. And the relative value, or the difference between the cost basis and the relative value basis, is that it really takes into account what the employer is getting for what it's paying on from benefit design. In other words, if one employer has similar costs to another, but the benefit design is richer, obviously there should be some consideration taken in terms of those differences. What I'm going to do is take you through some of the features of both the cost and the relative value approaches and the differences. Now, as I said, to start out with regard to the cost basis, and we will always be starting out with the cost and then comparing that to the relative value. On the cost basis, we're looking at the employer's total costs for salary, for medical, dental, vision plans, any health and welfare related benefits, as well as contributions to defined benefit retirement plans, defined contribution plans, retiree health, Social Security, and any other post-employment benefits. On the relative value perspective, we're doing all the same, but we're also taking into account the relative strength of those health and retirement benefit designs. And so in terms of the difference, what we're really recognizing is that if, for example, a health benefit plan costs the same but has a lower deductible or lower copays, that is more valuable. And as we look to recruit and retain people and look at our employee value proposition, it's not just how much we're spending, but what it is that we're offering to our workforce in terms of the value of these benefits. So that's the kind of overarching difference. In both approaches, we are using pay information, and typically we're looking at the midpoint of a pay range. So as we all know that there's an entry rate, there's a maximum rate, that's the pay range, and the middle of that is the midpoint. So we're going to start out by looking at, for reference purposes, the midpoint of pay ranges and using that for both perspectives. If we move on and look at the health-related benefits component, on the cost basis, what we are doing is looking at the enrollment patterns of our employees, and we're looking at the costs by type of plan, by tier of benefits, in terms of the actual enrollment, and weighting those costs appropriately. On the relative value perspective, we're doing the same thing. However, we're looking at not only the employer cost, but the split of the total plan cost between the employer and the employee, as well as the plan features such as deductibles, out-of-pocket maximums, co-pays, co-insurance, and the like. So here we're taking into consideration, if you will, the out-of-pocket costs that an employee may experience in using the plan or participating in the plan in terms of the employee picking up a piece of the costs. The point here being that total compensation can appear to be competitive on a cost basis, but when we take into consideration the value approach, when we take into consideration the out-of-pocket costs, the cost-sharing arrangement, that can give you a very different perspective on those benefits. Turning to retirement, on the retirement side, we are looking at, on the cost basis approach, the employer normal costs attributable to any defined benefit retirement plans, employer costs as a percentage of pay to defined contribution and deferred compensation plans, as well as I pointed out earlier, the cost of Social Security, assuming that in most cases in the public sector, people participate in Social Security. On the relative value basis, we're looking at the same things, but we're also looking at the consideration of plan design with the same issues of evaluating not just the budgetary costs, but the relative strength or value of those plans, particularly taking into consideration on the DB side, differences in multipliers, differences in definition of normal retirement, and so forth. Total compensation, therefore, on the cost side is simply an addition of the base pay, looking at the pay range midpoint, the employer weighted total health costs, and the employer total retirement costs. Whereas on the relative value basis, we're looking at those costs, but we're looking at those costs adjusted for the relative value of the plans. And again, the value of the plans may offset some of the cost differences that you see. In summary, this slide takes a look at the components on the left side of the cost basis, what's taken into consideration, and on the right side rises the items that are considered for relative value. And most of them, again, are the same or similar, with the exception that on the relative value basis, we're looking at differences in plan design. And we are going to, from here, get into a little bit more deeply into the methodological differences that are used in each of these approaches. So let's take a look at health benefits. So we'll do this for health and retirement. On the health benefits side, on the cost perspective, we're calculating the total employer cost, as I said, based upon the weighted enrollment distribution, not only among the tiers of coverage, but if an employer has multiple plans, exactly how those employees are enrolled or select the various plans, whether they be an HMO, a PPO, a high deductible health plan, and so forth. On the relative value basis, we're still looking at the selection patterns of employees among the plans and the tiers of coverage. But we're, in addition to the total cost of the plans, we're looking at features such as the employer-employee cost sharing, annual plan deductibles, out-of-pocket maximums. If we have a high deductible health plan and there are employer contributions to a health savings account, we're taking that into consideration, as well as co-pays and co-insurance costs. Similarly, on the retirement side, we're calculating on the cost side the employer normal cost. And I think for many of you on the call today, the reason we're using the employer normal cost is that it's really looking at a kind of stable basis for comparing costs from one employer plan to another. So we know, obviously, that different plans have different level of funding and different unfunded liabilities that may be amortized over time. For the purposes of these calculations, we look at the employer normal costs, particularly as it relates to the DB, defined benefit plans, and then look at any other additional contributions as a percent of pay. On the relative value side, however, we're using the same baseline cost numbers, but we're also taking into consideration retirement benefit formulas, early or alternative retirement benefit options, the impact of drop, service-related disability benefits, cost of living adjustments, and so forth. So we're really drilling down here in terms of the plan design, and this is really the case of the relative richness of the plans. Now, how do you calculate all these costs? So that's what we're really going to be getting into here. Again, for pay, midpoint of the pay range for health benefits, the total cost for health benefits calculated on this weighted enrollment distribution basis. The next slide is, as soon as it comes up, is a pretty busy slide, but I want to point out several sections of it to you. First of all, I always talk about the distribution of enrollment by tier of coverage. In the enrollment statistics section, which I'm pointing to right now, in this particular case, there are only 2 tiers of coverage just for simplicity. And you'll see there's employee only and family. In this case, there are about 1,800 people enrolled in employee only and 2,100 in family. So you'll see that the distribution is about 46% employee and 54% family. Turning your attention to the columns that say your jurisdiction total monthly cost, the left column is the total cost, meaning the sum of the employee and the employer cost, and the column immediately to the right of it is the employer cost. We look at each one of the types of benefits. So you will see on the left side that there's listed here in this example a PPO, a dental, and a vision benefit. These are the monthly costs attributable to each benefit for each tier of coverage, employee and family. And you'll notice for this particular city A weighted average, that we're using the 46 and 54% distributions to come up with a weighted average cost here. So for the PPO, the weighted average monthly cost is $1,193 and so forth. Year through a survey process and aggregate them in a similar manner, adding the cost program PPO. We could add HMOs. We could have any other programs that might be applicable. What we then do is look at the average single cost and the average family cost, as you can see it here, and $488 and $1,086, and then we go about weighting those costs based upon the enrollment. So what we're basically doing here is saying, if your employees, based upon your enrollment parameters, were to work at City B, C, D, E, and F, what would be the weighted total health and welfare costs attributable to those other peer cities? And therefore, we have the basis to compare, on a cost perspective, how much your city, $12,000 a year, is compared to the average of the marketplace, which on a monthly basis here is $811, or an annual amount of $9,727. Now, there are two numbers here that, if you can remember them for a later slide, I will referring back to, which is the total cost on a single and family basis for the PPO here in the base city, but we will get to that later. So that's the cost basis methodology for health benefits, health, medical, dental, vision, whatever the case may be. For retirement benefits, what we're looking at is the current employer normal cost for the DB plan, and based upon the most recent valuation, and the maximum employer contributions to DC, deferred compensation, and Social Security is applicable. And we have a chart on the next slide that uses a similar kind of approach. The summary statistics are on the left here. Our city, the total contribution as a percent of pay is 20.83%. In the market, it is 8.18%. Now, just to take you through this, we have four types of benefits actually: defined benefit, defined contribution, deferred comp, and we could have Social Security in there as well. Under defined benefit in column A, we have the normal cost as a percent of pay for each of the cities. Column B shows the total employer contributions, and column C shows by reference the total employee contributions. But again, remember, the purpose of this in looking at stability, we're looking at normal cost for defined benefit. If there was defined contribution or deferred contribution costs, we would total those costs in column H. So you would go across the row, come up with the total employer costs as a percent of pay for all types of benefits, calculate the average. You'll see that it's 8.18% there, and the total employer cost for City A, which is our baseline city, is this 20.83%. So we have these numbers, and then the question is, what do we do with them? How do we compare the total cost for our city versus the market for a particular job? And we do this, by the way, for a series of job titles, depending upon the nature of the survey, the nature of the employee group that we're talking about. So if we're looking at a police group, a public safety group, we would do this for each of the ranked titles by example. This slide shows you the annual total cost for a particular position based upon the pay range midpoint, the weighted health cost, and the total retirement. So what you'll see is for City A, what the pay is for what the midpoint pay range for base pay is. The $12,000 you may remember from the health and welfare slide is the annual cost of benefits there. The retirement costs is calculated based upon the 20.83% total contribution cost we said that City A showed, so that's $10,529, simply a mathematical calculation against the base pay of $50,549. For the market average, we gathered base pay information for a particular job title, and that market average is $63,329. The health and welfare costs are $97.27. The color coded these. If you said, it means you really are below market, and if you see blue, you are above market. That base pay for City A is 80% of market, so significantly below, but the contribution for health and welfare is at 123% of the market, and retirement benefit costs are 203% of the market, and that's really reflective of the differences in the contribution rate as a percent of pay. Overall, when you add the different pieces, in this particular case, City A is still slightly below market at 93%. But the point here is that this shows, even on a cost basis, that intuitively that City A has seemingly made a decision to spend more than the market average on benefits and less than the market average on pay. When you add them together, it results in being slightly below market. And now we're going to compare these results to what happens when you take into consideration the differences in plan design. And we're going to start with that in the next slide. Here we're now embarking on the relative value methodology. And we're going to do the same thing in terms of discussing health and then discussing retirement. Again, here, simply what we're saying is that we're looking at the total for all health-related benefits based on enrollment distribution, tiers of coverage, and so forth, and then adjusting for the relative value of these differences in plan design in terms of what we see among the peer employers for the various factors that I mentioned. What does this relative value look like? In this chart, and this is an example for uniformed police personnel, we have 5 cities, the same 5 cities we're comparing to. And we have a model that takes the various features, plan design features of the plans, the medical, dental, and vision plan for City B, City C, and so forth, and compares them on, if you will, a percentage basis to City A. So you'll notice City A has a 1.00 on the bottom of each column for medical, dental, and vision, and that's really saying we're starting with a 100% or a relative value of 1. And if you'll note on the bottom of the slide, it says that if the relative value is greater than 1, then it means that that plan has a greater value. It is richer than City A. And if it has less than 1, then it is less rich than City A. So by example, for City B, you see the medical plan is 1.0467, or a little bit less than 105% the value of City A. Dental is about 110% of City A, but vision is only 65% of City A. And you'll see, again, that we look at these relative values and say, what's the market average relative value for medical? It's about 16% higher than what City A has to offer, but the average for dental is about 16% less, and vision is significantly less. So you can see here that there's been some obvious trade-off in terms of the plan designs, in terms of the relative richness of the plan designs between City A and the peer employers. Now, we want to take those relative values into consideration and apply them to the total cost of City A's plans and again, holding constant enrollment and the distribution of enrollment and so forth. The next slide is a little bit complicated, but does get us to where we start to see these differences. And the slide is notated with formulas to help us understand what the calculations are all about. But before I do that, let me just explain the columns which are labeled columns A through F. Obviously, we start with the peer city, and we indicate the name of the primary health plan we're talking about. This is just medical now. This is not vision or dental or anything like that. And we would do the similar kind of analysis for each of those plans, but for the purposes here, we're just looking at the medical. Column A shows the relative values that came from the prior slide, where our model looks at the features and ranks each of these plans based upon the richness of the features. Column B speaks to the employer share of costs for single coverage. Remember, in this case, we only have 2 tiers of coverage, single and family. And column C shows the relative value adjusted cost for the single coverage in City A and City B and so forth. How is that calculated? You'll see the formula on the bottom that says C equals A times B times the total annual cost of your jurisdiction's coverage. So in simple terms, that dollar amount is the relative value, in this case 1.0467, times the fact that in this case the employer in City B is paying 100% of the cost, times City A's total cost of single coverage. You may remember I asked you, if you could, to remember the numbers 519 and 1766. Those 2 numbers were the total employer cost for medical coverage in City A. So for each one of these cities, for single coverage, we take into consideration the relative value of the plan of benefits and the share of the cost that is paid by the employer. In City A, 90% of the single coverage cost is paid by the employer. But in City B, 100% of the cost is paid. And in fact, in City B, not only is 100% paid, but the relative value of the plan is about 5% greater than City A. Columns D and E are the same type of calculations or considerations, except at the family coverage level. So the dollar amount on a relative value basis in column E is calculated by the relative value, the 1.0467 for City B, times the employer share of cost, in this case 67%, times City A's cost of coverage, total cost of coverage of 1766. And so you get these relative value adjusted calculations. Column F is really the weighting of columns C and column E. So remember, 46% of our employees were in single coverage, 54% were in family coverage. So we weight those relative value adjusted numbers in that fashion. We do that for each of the peer cities, and we come up with those calculations. Now, if we know that is all applied in the next slide, we do that for medical, we do that for dental, we do that for vision. If we were looking at a high deductible health plan with an HSA, we would include any employer contributions there. But for simplicity's sake here, what we're looking now at is the sum of the relative value adjusted benefits for City B, which is 11,645, City C, 6,988, and so forth. The average of those contributions is 13,045 compared to our $12,000 cost. So what we're saying here is based on a relative value methodology, the market average for weighted health plan costs is $13,045 compared to $12,000. Therefore, the value of City A's health benefits package is $1,045 less than than on a relative value basis. Now, what's interesting here is that the market average on a relative value basis is $13,045, and you may remember from a prior slide on a cost basis, it was $9,727. So the market average actually increased in value because the benefits offered by the peer cities had on average, a greater relative value. In other words, the plan designs were relatively richer compared to City A. That said, let's move on to the similar kind of methodology for retirement. So the relative values of the defined benefit retirement plans are determined comparing, as I said, the normal cost of each of the plans, taking into consideration for differences in the plan design, normal retirement benefits, employer cost sharing, what employers contribute as a percent of pay versus what employees contribute percent of pay, and then take that into consideration for each of the types of retirement benefits that may be offered. The next slide looks somewhat like the health benefits slide. Column A is the relative value. So just as we have a modeling tool to look at the relative value of health benefit plans, we have a similar tool that examines that for retirement benefits as well. And in a similar way, if the relative value is greater than 1, it is richer than our plans, and if it is less than 1, it is less than, not as rich as our plans. So column A shows the relative values. Interestingly, you'll see there's a market average row of 0.99. So on average, across these 5 cities, the relative value of their plans are pretty much equal to City A's. Column B is the employer normal cost as a percent of pay. Column C are the total employee contributions as a percent of pay. And column D is obviously the total plan costs, B and D. And we have those there because we want to calculate what the employer's share is on a percentage basis of the total cost. So column E takes the employer the total employer contributions and divides it by the total plan cost. So you'll see for City B, the employer picks up 40% of the cost, City C 57%, and so forth. And if you look at the market average row, and this is interesting, the market average overall, employers pick up 40.38% of the total cost, whereas in City A they pick up 67% of the total cost. So the question becomes, as it was with health benefits, what is the employer's cost for retirement on a relative value basis? And column F is the column that shows that. And in a similar way, what we're doing is we're taking into consideration the relative value of each city's plan and the cost sharing that is in column E times City A's total plan cost. And you'll see that in the lower right-hand corner. So let's just stick with City B, for example. City B calculation is City A's cost 31.08% times the relative value of 1.16 times 40%, and that gives us the 15.46%. When we look at those employers' costs, contributions on a relative value basis, the average contribution is 12.44%. And here we're just talking about the defined benefit plan. If there are other benefits offered, column G, by example, although there are no numbers, in it would have, or no employer cost numbers in it, would be added, and column H simply is the sum of those contributions as a percent of pay. The average overall is 12.44% as a percent of pay, as opposed to the 20.83%, which is the City A's contribution. So, as we did on the cost basis, we now put this all together to look at total compensation on a relative value basis. Here we see again for a particular job title, base pay at the pay range midpoint for City A at $50,549, and for the market average at $63,329. This is no different than on the cost side. But on the health side, we now see a difference where City A is $12,000 and the market average is $13,094. So now the City A is 92% of market. And on the retirement side, when we consider the relative value, City A has a cost of $10,529, which is, and the market average is $78.79. Overall, on column D, for a total compensation on the relative value basis, we see that now actually City A's position has decreased in competitiveness down to 87% of market. And then in the next slide, we will show you those two approaches and what the differences are as a result of them. In this slide, the first major row is the overall average cost basis. The second section is on a relative value basis. Now, there's no difference in terms of the market position on pay. It's still at 80%, very non-competitive. But whereas on health, it looked like benefits. This can have a material impact on the difference in the relative position. Now, in both of these cases, whether it's on cost or relative value, the end result was being below market. But it certainly is the case that you could be at market, and quite frankly, this City A is very close to being at market, where 95% is the lower boundary of what we consider market competitive. And on a relative value basis, this is significantly below market. So, in summary, I want to say that measuring total compensation on a cost versus relative value basis can really provide some valuable information. Certainly, in bargaining, to understand not just what the cost is of various benefits in a real granular form in terms of health benefits, dental, vision, various types of retirement benefits, and perhaps even negotiating changes in the plan design. What does that mean? How does it affect cost? How does it affect your competitive position in terms of the richness of the benefits is really important. It's not just about the cost, but it's about the competitiveness of the compensation package. And to my opening slide, where I mentioned that the issue that we're trying to address is the ability to recruit and retain. Recruitment and retention are not just about dollars in the paycheck, but are about the real, if not perceived, importance or value of the benefits that are brought to the workforce as part of that employee value proposition. So taking differences into consideration, plan design differences into consideration is important. This also enhances our understanding of total compensation arrangement between employers and employees, and the knowledge of these two approaches, the application of these two approaches is certainly important from our perspective in negotiating or establishing a total awards policy in terms of where does an employer want to be in the marketplace, how do they want to differentiate themselves from other employers in the marketplace, how do you become an employer of choice, how do you set yourself apart to enable you to recruit and retain the talent that you need to deliver the services to our public sector constituents. So with that, I'm happy to take any questions folks may have.
Thank you, Elliot. You did such a good job. We don't have any questions. So unless there's anything else you would like to finish with, we can conclude the webinar today.
I think my final comments are it's not just about cost, it's about what you are getting in return for those dollars that you're spending. And certainly I've been involved in lots of conversations, both with regard to either designing compensation systems or in labor negotiations about those very issues. And that's why we think that this is a perspective that is worth taking a look at. Thank you.
Great. Well, thank you, and thank you to everyone for joining us today, and we look forward to seeing you at the next NCPERS Center for Online Learning event.